If you were to have surgery today, would you know how to care for your incision? After my recent knee surgery, I had no idea what to do to keep my incision clean between appointments. So in this presentation, I will be teaching you the importance of keeping the incision area clean and also the basics of cleaning the area and making sure that it stays free from infection. Proper incision care reduces the chance of infection in the area. It can help to reduce pain, and it also helps to reduce scarring. First, I'll start with the things that you need to clean the area. You will need clean dressing, whether that be gauze, a stocking, steri strips, things that keep the incision protected while it's in the healing process. You will need a clean washcloth. You will need cotton balls, antibacterial soap such as Dial. You will also need vitamin E oil, and you will need a sterilized basin or bowl filled with warm water. When you have all of your items together, you can go ahead and start your daily inspection of the area. Before you do this, or you take any of the dressing off your leg or wherever your incision is, make sure that you thoroughly wash your hands with soap and water to keep germs out of the area where the surgery was. To do your inspection, you need to undo your dressing. I'll remove my brace so you guys can kind of see my incision. It's healed now. But you want to look around the area and make sure that it is not red or swollen more than it's supposed to be or hot to touch. You also need to make sure that there is no drainage or there is no fluids coming out of the incision itself. And you need to make sure that your pain level is decreasing instead of increasing. Your pain level after surgery should decrease daily. If you have increasing pain or consistent pain that wasn't there before, these are all signs of infection. You should contact your doctor immediately. Now, I will show you how to clean the incision during the healing process. What you will need to do is get your basin with warm water, your towel, and your antibacterial soap. You basically rub the soap on the towel and you clean the area. So you start and you rub lightly on the incision itself, getting all the peeled pieces to come off, and you clean around the area itself. So after you get that done, you'll let it air dry. During the healing process, most of the time you will have stitches, staples, steri strips, something that is helping your wound close. Make sure you don't rub hard enough to pull those apart or rip those off. Also, make sure that you let your incision air dry. The importance of letting it air dry is to decrease the amount of moisture stuck in once you put your dressing on. Moisture trapped in can keep the incision wet and keep it prone to infection, so we don't want that to happen. It also keeps the area dry and lets air flow freely through it, so that way healing is encouraged. There is a note that I have for you. When you are cleaning a healing incision or a wound, please do not use alcohol, hydrogen peroxide, or iodine, because all three of these agents, even though they are used to sterilize cuts and things of that sort, if you have a major incision or a major wound, they will do more damage to the skin and the healing tissue than is worth actually cleaning it out. So an antibacterial soap and warm water is enough to get the job done. Another tip, while your incision is healing, please don't pull, rip, scratch any of the scabs from the healing area. Doing so can cause more scarring, and it can also open up areas of the incision that is not completely healed. Now that you know how to clean a healing incision, I will show you how to take care of an incision once it is completely healed. A lot of people think that once it's healed, there's nothing that needs to be done to encourage the scar to become lighter, match your skin, and things of that sort, which is not true. The best way to do this is to get a cotton ball and your vitamin E oil. And then you dab some on the incision. I will get closer so you can actually see the incision itself. Dab it on the incision after it's healed, and then massage it in a circular motion until the oil is equally distributed across the incision. Another thing, after your incision is healed, keep it out of direct sunlight for up to 6 months. Sunlight will cause the scar to stand out. It will not help it fade like the vitamin E is supposed to do. It won't blend or smooth it into the skin. And if you want your scar to sort of vanish or disappear, keeping it out of the sunlight and using the vitamin E oil twice a day will help to accomplish that. Knowing the basics of cleaning an incision and incision care is something that everyone may need, and it may become handy throughout your life, whether it's you or a family member, a loved one, or a friend who has surgery or sustains a major injury. So thank you for listening, and I hope that you took away something useful from this presentation.